Okay, hello everyone. So this is the part second of the video topic pharmaceutical packaging. Now to go a little bit briefly about what we discussed in the last video, we started off with pharmaceutical packaging, what actually do we mean by packaging. Then we discussed about the types of packaging, as in primary, secondary and tertiary, and its use and importance. Then we shifted towards the types of packaging material. Like in the last class, we discussed about the glass as one of the pharmaceutical packaging material, and also we looked into the disadvantages and advantages, and also we did discuss about the pharmaceutical packaging evaluation test for glass. But we will go deep into it, how the parameters are done for the evaluation. But also we did know that the glass is basically of 4 types as well as non-parental. So also we classify the types of glasses associated with the material, like what type 1, 2, 3, 4, what type of glass is used for ampoules, closures, and so on and so forth. So now we'll look into the second part of the packaging material, which is plastic. But before moving into plastic, I want to tell you that glass, we know that one or two, I would say 2 of the major disadvantages associated with glass is, A, we all know that it is fragile, right? There's a lot of care and precaution to be taken while handling a glass material. Secondly, it is not only it is fragile, but also it is heavier in weight. Okay, though nowadays there are a lot of kind of glasses where we having a mismatch as in we do add some type of plastic or elastomers in the preparation of glass, so that the weight is decreased and it is bit lighter. But at the same time, since a lot of care and precaution has to be taken, and so plastic came into existence. So plastic, there are 2 types of properties or 2 types of plastics based on these properties. One, we have thermoplastic, and the other is thermosetting. We will look into this, what are these 2. Now, thermoplastic means that technically whenever there is a change in temperature, pressure, or any applied stress of any kind, then it tends to, there's a random movement of the atoms in the lattice, crystal lattice, and hence that particular movements tend to form a temporary different crystal state. Okay, we can see, for example, if this is a normal one, okay, this is the initial setup of atoms in a plastic. Then what happens when you apply stress? There is a change. You can see there's a random movement and a bit of a distance has been increased, inter as well as interatomic distance between the particles. But thermoplastic also means that whenever we deform it back to the same temperature, as in, for example, this is the original one and I have applied some stress, it gets into this type of structure. Whenever I remove that particular stress, it will automatically get shifted towards the original one. So basically this is a temporary or a transient type of a change. Now, thermosetted elastomer is a bit different. In this, what happens is there is an actual change in the cross-linking behavior, there is a change in the bond formation, and hence it is irreversible. Because when we apply stress, this is the original one, and when we apply stress or something, it tends to deform to another structure. It either cross-links furthermore, or based on the temperature, it loosens up the cross-linking behavior, or it sometimes may form a different kind of bonds based on the cross-linking between the atoms. So that's why we can say that thermoset elastomer is a permanent kind and thermoplastic is of a transient type, and it basically is interconvertible, the thermoplastic one. Okay. So we can see the difference clearly, that in thermoelastic we can see in the thermoplastic and thermosetted, this is the difference. Thermoplastic polymers, you can see whenever I have applied heat to this polymer, they tends to, this is supercoiling, so this is normal coiling, or they tends to uncoil themselves. But what happens with thermoset is they tends to coil, or there's a cross-linking, increase in the cross-linking whenever the heat is applied. So what happens is there's a lot of thermocoiling, there's a lot of cross-linking that happens. So you can clearly see this is a thermoplastic, this is a thermostat. Okay, and when you have applied thermoplastic polymers heated, then there is no particular change with respect to the cross-linking. Okay, don't get confused. The thing is that in thermoplastic, whenever polymers are heated, they tend to uncoil a bit, but they do not cause a particular cross-linking or any change in the bonds. But with type of a thermoset, there is a change. There is a lot of cross-linking happening there, and hence it is quite irreversible. Then we will look into the advantages of plastics. We know that obviously since the glass had a few disadvantages, and that's why we switched into plastic as one of the packaging material, and also it is widely used. So we will look into the advantages. One, low in cost. Obviously it's quite cheap than glass. Then because there are a lot of polymers, natural, synthetic, polypropylene, styrene, and so on. Like there are a lot of plastic polymers also. So that's why they are low in cost. They are light in weight, and hence it will possess a great amount of advantage to our industry. It is durable. You need not to take a lot of precautions as compared to a glass packaging material. It is inert, odorless, unbreakable, leak proof, which is one of the most important characteristics of a packaging material, and it should have an ideal characteristic of a leak proof. Ease of transportation, good protection power, resistant to inorganic chemicals. So after looking into the advantages, we know this, like these are some of the regular advantages of a plastic to be used as a packaging material. But there are some associated disadvantages, or you can say limitations. Adsorption and poor physical stability. Okay, like whenever you tend to, you all know that whenever we say that, okay, don't put any heated elements or heating thing over a plastic, because you know they get to deform and they burn. So they have poor physical stability, and also they tend to absorb a lot of chemicals apart from inorganic. They are permeable to oxygen, moisture, and carbon dioxide. So this again could be a major disadvantage. Why? Because we are packaging for a primary package to be used as a plastic. We are directly making our drug or API or a pharmaceutical ingredient in contact with the plastic. So if there is a directly connection between the plastic as well as your drug, then you know that a plastic has a disadvantage of permeable to oxygen or moisture. Then your drug can easily get degraded, and we don't want that, right? So that's why these are some of the limitations of plastic, which is also a major drawback for the packaging. But after that, we will look further that what are the probable options apart from plastics. So you all know that plastic bottles, they are made up of polypropylene, high density polyethylene, polystyrene. We know that. We have seen such kind of bottles. Plastic pouches for high density polyethylene. Okay, then we have bottle polyethylene and spray polypropylene. So we all have come across in a day-to-day life these kind of bottles. You can see this is a brown colored plastic bottle. It is amber coated for prevention of the light sensitive drugs, so that light does not enter and degrade our drug or pharmaceutical product. Then we will see into the product plastic interaction, which we were discussing, that why there is a drawback of using a plastic, because they tend to adsorb on the surface, as well as they are permeable to oxygen, moisture, and that could be harmful for our pharmaceutical product. So the product plastic interaction is one, we have permeation, they are permeable to oxygen, moisture. Then second is leaching. Now why there's a lot of focus on leaching is because the plastic content tends to leach out as in it will release its ingredients if put under uncomfortable circumstances or environmental conditions, extreme conditions for instance, and that plastic tends to leach out their ingredients into your pharmaceutical product. Okay, and sometimes that could be too harmful for the patient. Then I told you about the permeation. Permeation can lead to degradation of your product. Leaching could obviously will degrade your product, but as well as it can be very dangerous for the patient as well. Then there is sorption of various chemical ingredients. Then there can be a chemical reaction that would occur if the ingredient of the plastic is leaching out. Then it might get reacted with the products of your drug. Okay. Then alteration in the physical properties of the plastic. Now, if you are using a plastic container for a long period of time, then there might be some alteration in the physical properties. Also, I told you one thing, that extreme conditions may leach out or may affect the physical properties of a plastic, because plastic is very sensitive towards extreme conditions. They easily get deformed, right? Now, these are some of the tests for plastic containers. As I mentioned in the previous slide about the glass evaluation test, we have hydrolytic resistance test, we have powdered attack test, water attack test, and so on. We will discuss that. But the test for plastics we are discussing, like first we have leak test. Obviously, we want our plastic container or any other container to be leak proof. It should not leak out the ingredients or our pharmaceutical product. So what leak test does is, what is the basically procedure is, we generally take and fill 10 bottles, plastic bottles, which has to be used for packaging, with water. Okay, water is the solvent we are taking for evaluating the leak test, and fit the closure for 24 hours upright down. For a day you have to keep it upright down, and then you have to test for the leakage. If one is out of the range, out of the 10 bottles, then it's fine, but if more than one is there, then it is not suggested. Okay, because if one is out of the range, there might be some of the different options, or you can say different reasons for that one particular leakage. But else you have every 10 to 10 bottles has to pass this test. But if one bottle is defective, then you have to take another 10 bottles and do the leak test. Okay, but generally it is suggested that in the first lot you are randomly taking the 10 bottles. It is suggested that all the 10 bottles should pass the leak test. But if even one goes outside the range, as in if even one leakage happens from the bottle, then you do repeat it with another 10. So that's why 10 bottles should pass the leakage test. Second is water permeability. Now, water permeability, what we do is, if fill 5 containers with normal volume of water and seal it. Okay, fill the 5 containers with normal volume of water and seal it. Weigh each container and allow it to stand for 14 days at humidity 60% at 20-25 degrees Celsius. Then again reweigh the container. Then loss of weight in each container should not be more than 0.2%. Now I will let you know what actually happened in water permeability. We generally take 5 containers, we fill up the volume with water, and we generally seal it and we weigh it. Okay, now after weighing, say I am getting a particular amount, A gram I am getting. Okay, what happens is, we keep it in this, you have to learn this, like 14 days at humidity 60% at 20-25 degrees Celsius. After 14 days we reweigh it, then say we get a B gram of weight. Then the difference between these two should not be more than 0.2%. Why we are taking this difference, or why are we taking such a duration, is because we have to keep our pharmaceutical ingredient in that particular plastic packaging for a long period of time. So we have to see that if it is water permeable or not, if it is absorbing or getting absorbed with any kind of water particles or not. Okay, so that's why these are some of the two. You can do n number of tests, but the major ones are leak test and water permeability test. Then the third type of packaging material that could be used is metals. Now, metals, we know generally we use it for non-parenteral use. Always remember this. We use metals for non-parenteral use. Also, tin is one of the metal that is used that is chemically inert. Aluminum is also used. It is light in weight and strong, and it is impermeable. Then there are two types of aluminums that could be used. One is thick, other is thin. Thick type of aluminum is used for making of aerosol cans and tubes, whereas thin type of aluminum is used in flexible foils, laminating packaging material. Okay, we know that we generally use aluminum at our homes, in our homes as well, for wrapping up the chapatis. But these are two types of aluminum type, thick and thin, which are generally used for aerosol cans and tubes and foils respectively. Then there are disadvantages as well associated with aluminum. One, corrosion. It is more towards rust prone, and reactivity in raw state. If we do not add some of the oxides with the aluminum, then it is very reactive. Okay, it can react with your product as well and can be very harmful. So to decrease its reactivity in the raw state, we line that with epoxide, vinyl or phenolic resins. We generally mix, we extracted the aluminum in a raw form and we mix it with epoxides or vinyl polymer or phenolic resins, so that the reactivity is decreased and it does not react with our product. Then one, I discussed tin, then aluminum. The third one is lead. Lead is quite cheap than all of the above, and it is used for non-food products such as adhesive, inks and paints. Linings is basically used if the product is not compatible with the bare metals, then the inner surface of any metal is coated with a wax-like material. Okay, that is called linings, because we line them with a wax material so as to decrease the reactivity of the bare metals or any of the metals that is highly reactive and we want to use it. So we generally coat that with a wax layer so that the reactivity is controlled, okay, and it does not interact with our product, pharmaceutical product. So metals, always remember, this is used for as a non-parenteral use, because if we use it for parenteral use, we know that metals tends to cause toxicity. They are corrosion prone, so they are inserted inside your body that can be toxic, right, and that can accumulate and can cause adverse drug reaction as well. And hence metals are always used for non-parenteral. Then the fourth one, that is, the first one was glass, second was plastic, third was our metals, and the fourth one is rubber. So in rubber, we know that they are excellent polymer for forming seals like closures, vials, ampules sometimes. So rubber is a great alternative. Also, there are two types. One is natural and the synthetic. The natural one is basically becomes brittle with multiple autoclaving, because you tend to sterilize the product. You tend to sterilize the packaging material because they are in direct contact with your product, especially primary packaging. So that's why when you do a lot of autoclaving, multiple autoclaving, the natural products tends to becomes brittle. Okay, and there's also a risk of absorption as well with respect to natural rubbers, and there's a moisture and gas permeation, and hence natural rubbers are not that much used. Then we shifted into the synthetic one based on all these disadvantages associated with natural rubber. Then in synthetic, we can see tends to experience less absorption than natural. We generally add a lot of other epoxides or vinyls, as I discussed, and a lot of other things so that to make it more flexible with respect to the natural rubber. And hence synthetic, while manufacturing, we add a lot of things so that to make it less so that it causes less absorption and less permeation towards moisture and oxygen or gas. Silicone rubber are commonly used. One is heat resistant, low absorption, permeability, but are a bit expensive. But these are some of the majorly used rubber, which is silicone rubber. Then the next type of material we all know and we all are aware are fibrous materials. Fibrous materials basically are papers, cartons, bags, labels. Fibrous materials made up of papers, we know cartons, you might have seen these cardboards with shape, you can see this is a cluster okay, for putting up the things in a proper manner. You all have seen this such type of cardboards. Then we have packaging. We have two type of packaging, and it is highly essential to know these two types of packaging because it is very important with respect to the exam point of view as well as for general knowledge. Like we have two types of packaging in a pharmaceuticals. We have blister and we have stripe packaging. Blister packaging is basically made up of two components. Cavity is made up of plastic or aluminium, and lidding is made up of plastic, paper or aluminium. Cavity, you can see this type is your blister packaging. You have a cavity, this is your cavity, and this particular thing is your lidding. Lidding is basically the background, okay, it's the back wall. So this is the back wall and this is the cavity in which you have your medication. So this is type of a blister packaging, and I've told you cavity is generally made up of plastic or aluminium, whereas lidding could be made up of plastic, aluminium or paper as well. Advantages of blister packaging: it produces integrity, product protection, tamper evidence, reduce possibility of accidental misuse, patient compliance, because it is quite stiff also, okay, it does not get deformed easily. Even if you keep a keep this pack of 10 in your purse, then it is quite flexible. It will provide proper protection to your medication. So yes, it has a good set of advantages. But if we look into the stripe packaging, so we can see there's not a hard type of a lidding there. There's nothing called lidding in your stripe packaging, and product is enclosed between two webs of heat sealable flexible films. You have one film, and your material is here, and you tend to clip these both things, and so this type of packaging is called strip packaging. And you know that this is quite flexible. Why? Because it is moldable. It is easily moldable, but at the same time there is a high chance of damaging your product, and that's why the blister packaging is a bit on the expensive side as compared to your stripe packing. Now, I have shown a diagrammatic view of how a blister packaging occurs. So you can see that we have lidding material. Lidding is basically, I told you, the base, okay, the background, the base wall. The base is lidding material is here, okay, and there's already a cavity you can see already lined up. So from here only, from the start, we have the cavity, okay, and it is automatically filled with your medication, and as soon as it is filled with your medication, the upper lidding material is applied, okay, and it is getting covered and it is getting sealed. This is the cavity. Automatically then you have your ingredient inside it and you seal it with your lidding material, and this goes on and on. So this is a blister packaging, and we have strip packaging. Strip packaging is very simple. I told you, two webs of heat sealable flexible film get enclosed and your medication is in between. We all have seen these two types in our day-to-day life as well. Now these are some of the basic symbols we come across. Like whenever you can go through it, that whenever there's some danger sign, you know there's a poison or a danger in terms of pharmaceutical packaging. When there's some kind of this kind of a thing, then it means fragile. This is this way up, this arrow sign. Then if this is indicated, this means keep away from sunlight. This means keep away from water. This means recycle. We all know that this is commonly used. And this is extremely flammable. So these are some of the depictions of the symbols associated with our packaging in pharmaceuticals. There are much more, but I have just described few of them. Then the most important is the evaluation of glass containers, which we discussed, that we have powdered glass test, we have water attack test for the chemical resistance, for evaluation of chemical resistance of glass containers. Okay. Now, no need to go deep into it. Why? Because if we go deep into it, there's a lot of big procedures for the powdered glass test and water attack test. But with this, we can see that in the powdered glass test, you are crushing your glass material. Okay, you are crushing your glass packaging material, and then you are evaluating. Second is water attack test. You're just taking or you are the word suggests you are attacking the water to your glass containers to check its permeability and the resistance of the glass container. So that's why no need to go for the procedure, but yes, for the evaluation point of view, which type of glass takes up which test is very, very important. For example, I have mentioned that this is a type 1 type of a glass which is highly resistant borosilicate, type 1. So type of test we use is powdered glass. Okay. And the limits for ml of 0.2, basically you titrate it with 0.2 normality. So how many ml is the limit is 1. Okay, and the limit size is all for all types of glasses, be it 50 ml, 100 ml, all type of glasses of type 1, they undergo powdered glass test and the limit is 1 ml of 0.2 normality. For the second type of glass, we have treated soda lime, we know that, and we do for water attack test, and it is very important that water attack test is the main type for type 2. Always remember for the type 1, 3 and 4 we have powdered glass test, and for type 2 it is very important, for type 2 we have water attack test. And also water attack test, this type 2 is divided into 2, 100 ml size or less and 100 ml more. So if 100 ml less it is 0.7, if 100 ml and over, 100 over as in over, that is more than 100 ml, 0.2 is the limit. So you must remember these things because a question is a must from these evaluation tests. Okay, so we have discussed the type 3, we go for powdered glass test, and for all types of containers no size limit is there, and 8.5 is the limit. Then for general purpose powdered glass test, which is type 4, and 15 is the limit. So you have to just learn and learn this chart, and no need to go deep because the whole procedure is a long one for the powder glass test and water attack test, and also the main limits come in your paper. So you have to cram all this. Then the last thing that we'll discuss is the type of packaging for the children, you know, like we have child resistance and pilfer proof packaging. You know, this is a pilfer proof packaging and this is child resistant packaging. Why it happens is because there is a lot of cases in which the children, whenever we have kept a plastic bottle or any medication, they can easily open it and take it. So in order to stop that thing, because it is quite dangerous, we provide us with the child resistant and pilfer proof. You must have seen these kind of packaging and the closure tips, you know, in your house. So that is mainly because of the providing you with the child resistant pilfer proof packaging, so that your child or anything is not misused. Okay, so with this the packaging is over, and if any doubts you can reach out to me. Okay, so thank you.